Good afternoon, everyone. Today I will be presenting our study on clinical morphology and AIOS2025 analysis of trabeculectomy blebs. Glaucoma is a progressive optic neuropathy where long-term IOP control is essential. Trabeculectomy remains the gold standard to achieve this goal. However, its success relies on the functionality and the longevity of the filtration bleb. Traditional slit lamp biomicroscopy offers limited insights, whereas AIOS2025 allows for a detailed structural evaluation of bleb morphology, enhancing our ability to predict surgical outcomes. So our study aimed to analyze trabeculectomy blebs both clinically and through AIOS2025. We classified blebs based on their morphology on slit lamp, evaluated their internal architecture on AIOS2025, and correlated these findings with IOP control and surgical outcomes. Additionally, we compared AIOS2025 findings with slit lamp assessments and analyzed early postoperative changes, including optical intensity of blebs using ImageJ software and impact of the interventions. This was a single-center prospective observational study conducted over 1.5 years, including 68 eyes of patients with POAG, PACG, and secondary glaucoma. These were our inclusion and exclusion criteria. Patient underwent standardized trabeculectomy with mitomycin C and in some cases combined cataract surgery, both by single site as well as twin site techniques. We performed comprehensive ophthalmic evaluations, graded blebs using the Indiana Bleb Appearance Grading Scale, and conducted AIOS2025 imaging at 15 days, 1 month, and 3 months post-operatively. This is how the Indiana Bleb Appearance Grading Scale looks like, which was used for our morphological assessment on the slit lamp. As for the AIOS2025 analysis, with the patient looking down, radial scans were taken through maximum point of elevation on the bleb as shown in the figure. The bleb wall reflectivity was classified as uniform reflectivity or multiform reflectivity, depending on the presence or absence of hyper and hyporeflective areas in the bleb wall itself. The uniform reflectivity looked like smooth hyperreflective wall with no or minimal fluid-filled hyporeflective spaces within. The multiform reflectivity of the bleb indicated multiple tiny cavities of aqueous drainage like multiple internal layers, subconjunctival separation or presence of microcyst within the bleb wall. We calculated the bleb wall parameters such as total bleb height, bleb wall thickness, and fluid-filled cavity height. The preoperative mean IOP was 23.29, while postoperatively the mean IOP at 15 days was 14.59, at 1 month 14, and at 3 months 13.41 millimeters of mercury. On clinical and AIOS2025 analysis, we observed that taller blebs were associated with better IOP control. Over time, bleb height decreased and wall thickness increased, which indicated maturation of the bleb. For reflectivity patterns, AIOS2025 revealed two types: the uniform reflectivity, which was associated with higher IOP and lower filtration efficiency, and multiform reflectivity, which indicated multiple drainage pathways and better IOP control. AIOS2025 demonstrated that multiform reflectivity was maintained in 92.9% of eyes following postoperative interventions, whereas untreated bleb showed a conversion to uniform reflectivity, leading to a marginally higher IOP compared to the multiform group. This slide also shows the average optical intensity, which progressively increased as the bleb matured. The bleb height gradually decreased, which indicated bleb maturation. The bleb wall thickness increased, which indicated stabilization of the bleb wall. And we noted that multiform reflectivity was a positive predictor of long-term success. Procedures such as 5FU injections, laser suturolysis, and bleb massage played a critical role in maintaining good bleb function. Our study highlights the importance of AIOS2025 in postoperative trabeculectomy assessment. Multiform reflectivity and taller blebs predict better IOP control. Early identification of bleb characteristics can guide timely interventions. Integrating AIOS2025 into routine follow-ups can optimize surgical success and reduce failure rates. So to conclude, AIOS2025 provides a superior method for evaluating trabeculectomy blebs compared to slit lamp examination alone. The recognition of key AIOS2025 features allows for tailored postoperative strategies to prevent bleb failures and to improve long-term outcomes. Thank you.
Dr. Aanchal Gera, please come on the dais.
How has your study clinically added to our knowledge about the existing knowledge about these features which are already well known on ACE OCT and various bleb classifications. We already know what happens to these blebs on morphology on ACE OCT. So what additional knowledge have you added to us today?
Madam, I wouldn't say this is a very unique study, but of course in our study we have tried to integrate the clinical morphology with the AIOS2025 characteristics, and we have tried to identify those early AIOS2025 characteristics which could indicate impending bleb failure and the timing of the suitable interventions. So many of our patients have undergone variety of interventions, including 2 of them having gone bleb needling also. Of course, all of these clinical decisions can be taken on the clinical morphology basis alone, but then AIOS2025 gives us a more objective assessment, especially looking at that multiform reflectivity, gives us a confidence that this is a kind of bleb which will survive in future.
Your study is only 3 months of follow-up, and it is said that almost 50% of the trabeculectomies fail over 5 years. Is there a predictor of long-term success that you can think of from your study?
No, sir. This is the most important limitation of our study, that it was conducted for only 3 months. We had targeted for at least 6 months, but we couldn't get a good follow-up, sir.
Okay.